Hello, my name is Hillary Wynn. I'm a second year SRNA at the Raleigh School of Nursing Anesthesia through UNC Greensboro. This is my husband, Min Wynn. He is a plastics president at Ohio State University. And today we're going to be talking about substance use disorder, specifically signs to look out for and intervention strategies for SRNAs and CRNAs, people in the anesthesia profession. So, substance use disorder, what is it? It refers to the recurrent use of alcohol and drugs that causes clinically and functionally significant impairments such as health problems, disability, or failure to meet major responsibilities at work, school, or home. Substance use disorder is different than addiction. Addiction is the most severe chronic stage of substance use disorder, and it usually signifies a loss of self-control and compulsive drug taking despite desire to stop taking the drug. So, why are SRNAs at particularly high risk? It's estimated that 10 to 15% of all clinicians, including anesthesia professionals, will misuse drugs or alcohol at some time during their career. There's greater risk among anesthesia profession than other practice specialties because obviously it's demanding, and there's increased availability of highly addictive medications such as fentanyl, narcotics, and we all know that propofol is usually unregulated, so that's become much more abused in the more recent years. And then there's specific SRNA risk factors. We have high performance expectations, financial stresses. I know both of us have student loans and you're the only one making an income now, so that's definitely stressful. We have decreased time for self and family. SRNAs go back from expert as a nurse to novice as an SRNA, which can be a stressful transition, and that we often have lack of coping skills. So there are also risk factors in the individual. These risk factors can be psychological, such as a history of depression and anxiety, low self-esteem, and addictive personality. These are all very high risk factors for developing substance use disorder. Anyone with a stressful home environment, anyone with a traumatic past, or a family history of substance use disorder. There are also workplace-specific risk factors, such as irregular work hours, inadequate work-life balance, and a high-intensity work environment, which is basically anyone who works in the OR. It's very stressful. It can be very stressful. So these are signs and symptoms that I want you to look out for in me and in my friends and in any professionals that you work with in the hospital, particularly in the operating room. CRNAs, anesthesiologists, everybody. So you'll frequently see severe mood swings, underperformance, frequent or unexplained tardiness or work absence, confusion, memory loss, difficulty concentrating. You may see these people have problems with their relationships, with their home life. They may have a significant weight loss or gain. They may look disheveled, bloodshot eyes, and it may have poorly explained errors, accidents, or injuries. So drug diversion is different than substance use, and there's different things to look out for. People who are diverting consistently use more drugs for cases than their colleagues. They consistently arrive early or stay late. They have frequent breaks or trips to the bathroom, heavy wastage of drugs, and their patients may be in severe pain after the procedure, even though it's documented that they received quite a bit of pain medicine. So what are you going to do if you suspect any of these behaviors in me or people you know? Well, if it's me, every state has a peer advisor under the AANA, and our state advisor is Linda Stone, one of my professors, and I have her phone number for you after this video. But if you're not in North Carolina, if you suspect anyone here, you don't know who the state advisor is, you can call the helpline, which is right here, and that is also through the AANA. They will specifically deal with any SRNA or CRNA that you suspect having problems. So here's some other resources, mostly through the AANA website. They have a lot of good information out there, and it's available to anyone. You don't have to be a member of the AANA to see this information, so definitely recommend taking a look at it. Okay, and if you're planning on having an intervention, these are some suggestions and tips in order to do that. Make sure that you assemble a team, and you may or may not want a professional there if it's a severe case. You want to gather all evidence, so talk to people who have witnessed the same things you have. Make sure you have it written down. Any documentation that you have will help support your claim. Once you start the intervention, you want to make sure the person doesn't leave. They're at for risk for hurting themselves if they're able to leave during the intervention, because it's a very stressful time. And ideally have them take a drug test if you can. That way you can have some more concrete evidence. And if you are going to have an intervention, make sure that you have a bed in a treatment facility ready. That way, if the person decides that they're ready to get help and you tell them that they can't go to the facility for another week, it's easy for them to change their mind and go back to their old behaviors. And when all else fails, threaten to call the police. That's like a last-ditch effort. So, as far as preventing substance use disorder, we've all learned this in school, particularly in nursing school and mostly even in elementary school. Like, we learn this starting from child age years. But, want to try to eat healthy, exercise, ensure adequate sleep, take time for yourself. And it's always suggested to tell people when you start to feel overwhelmed. Don't wait until things get out of control. So ultimately, if you see something, do something. And this is very important because you as a spouse may recognize abnormalities in my behavior more early than people who I work with or anybody else that I'm not as close to. So you might be the first one recognizing the signs in people that you know. So it's important to go ahead and say something early on. That way you can either stop it from getting worse or intervene earlier rather than later. And that's always recommended. And even if a SRNA or CRNA has to go to a rehab program, it's possible for them to return to their school or practice after the rehabilitation period. There's strict guidelines for that, but it is possible. So, Min, I want you to tell me a couple of things that you learned today from this presentation.
So, the first thing is realize that your profession is a really stressful profession, and it has a lot of risk factor that for high substance abuse, for example, just availability of the drugs, highly addictive drugs, really easily accessed and really not highly supervised, and realize that you guys are in a stressful situation, dealing with a lot of loans, dealing with the stress from school, dealing with sometimes it's just the lack of coping skills. And then the next thing is to realize who is in danger, who is in at risk, who has the signs and symptoms of substance abuse, including coming to work late, underperform, the appearance wise, signs like physical exam sign like bloodshot eyes, and also like you're looking at some behavior in terms of that can point you toward like drug diversion, using more narcotic in a case than normal. Patients still have pain even though after you use a lot of narcotics, documented, right? And then the next thing is how to help them. You can use the helpline over here. If you don't know it, your state peer advisor. The thing is, and if you plan for intervention, make sure you have a full team ready, and make sure you have every other treatment plan ready, in case they agree to your treatment, right?
Very good. Okay. Thank you for your time. Thank you for listening, and I can see that you learned something today. So thank you very much.